Are you or your providers providing assessment and specimen collection for COVID-19? If the answer is yes, let's chat a bit. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've helped hundreds of students become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Subscribe to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. Did you know practitioners can be paid for assessment and specimen collection for COVID-19 testing? Well, they can. And it can be done with CPT code 99211, except if the provider is reporting another evaluation and management code for a concurrent service. Medicare will recognize this code for all patients, not just established ones. Again, this guidance is for Medicare. You will want to check with private payers on their policies regarding this code for this service. CPT code 99211 is for office or other outpatient visit for the evaluation and management of an established patient that may not require the presence of a physician or other qualified healthcare professional. Usually, the presenting problems are minimal. Typically, 5 minutes are spent performing or supervising these services. Speaking of codes and medical coding, let me ask you if you are interested in getting medical coding education and training, and if you are interested in information regarding our online medical coding course. Let me invite you to our last online live Q&A information session of the year on Saturday, November 27th at 10 a.m. Eastern Standard Time. To register, see details in the description box and check this out. Are you confused about all the medical coding programs, but unsure what to ask? Do you want to make sure you get everything you need to learn medical coding and become certified? Well, join me on the last Saturday of every month at 10 a.m. Eastern Standard Time, where I will answer your burning questions regarding medical coding. Join our monthly medical coding course Q&A session. To join us, click the link to register. Can't wait to see you. Also, during the public health emergency, CMS is allowing any healthcare provider authorized under state law to order tests. Medicare will pay for tests without a written order from the treating physician or other practitioner. If an order is not written, and ordering or referring National Provider Identifier or NPI is not required on the claim. If an order is written, include the NPI of the ordering or referring professional consistent with current billing guidelines. Again, because things can be different, check with your private payers to determine their policies on test ordering. If your provider is using or plans to use 99211, the CS modifier, which is the cost sharing modifier, should be appended to 99211 to waive cost sharing. Speaking of cost sharing, until the end of the public health emergency, CMS is waiving coinsurance and deductible amounts under Medicare Part B for Medicare patients for certain COVID-19 testing related services. The cost sharing waiver applies to medical visits when an outpatient provider, physician, or other providers and suppliers that bill Medicare for Part B services orders or administers COVID-19 lab tests, specifically using U0001, U0002, or 87635. The services visits for which cost sharing is waived includes the following: services resulting in an order for an administration of a COVID-19 test, services related to furnishing or administering such a test or to the evaluation of an individual for purposes of determining the need for such a test. Any of the following categories of HCPCS evaluation and management codes in the office or other outpatient services, hospital observation services, emergency department services, nursing facility services, domiciliary rest home or custodial care services, home services, and online digital evaluation and management services. CMS has also implemented a no cost sharing requirement for group health plans and group and individual health insurance to cover both diagnostic testing and certain related items and services provided during a medical visit. This includes urgent care visits, emergency room visits, and in-person telehealth visits that result in an order for or administration of a COVID-19 test. For Medicare claims, to indicate that a service is subject to the cost sharing waiver, the CS modifier must be added to the appropriate claim lines. If claims were submitted to Medicare without the CS modifier, notify the Medicare Administrative Contractor, or MAC, and request to submit the applicable claims. These reporting instructions apply to Medicare beneficiary claims. Remember to check with private payers for their specific reporting guidelines. You have learned how practitioners can be paid for assessment and specimen collection for COVID-19 testing and who can order these tests. You have also learned about cost sharing and its requirements. And lastly, you have learned that I am hosting our final live Q&A information session for the year on November 27th at 10 a.m. Eastern Standard Time. You will get information on our end of the year course specials, and I'll answer your burning questions regarding our online medical coding course. Click the link in the description box to register. Question of the day. Was this information helpful for you, and did you learn something that you can apply? Let me know your responses in the comments below. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. If you are interested in more information on these tips and others on how to become a certified marketable medical coder, well, check out these videos and check this out. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you like the information in the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment or question. You can also give me a little love by sharing this video on your social media platforms. Let's stay connected and connect others. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.